a month ago. This virus, not much is known about the properties. There are only a couple of articles which we are learning. And from those articles, we understand that this virus, all of the patients who had this virus had pneumonia, lung infection. And 1/3 of those patients were very sick who had to be admitted to the ICU. And out of them, 14% expired. So this virus can be lethal. I have shown in the diagram the picture of the coronavirus, how it looks like. Can you move forward? So how contagious is the virus? The research is still in process, but what we are learning is that one person who is infected with this virus can infect up to 3 more individuals. It may not be as contagious as some of the other known viruses, for example, measles and the mumps, that can infect up to 18 individuals, but it's still too early to say and predict how contagious this virus can act. Can you move forward? So the global outlook, so currently what has been reported is that more than 40,000 cases all over the world. Most of the cases are coming out of the Southeast Asia and the China. There have been total of 12 cases, can you move forward? In the US, and I've highlighted in the dark yellow color, this is directly obtained from the CDC website, 12 US cases and the states where the coronavirus have been identified. Move forward. So how is it transmitted? So what we are learning is that it's like other coronavirus, it is zoonotic, meaning that it was initially transmitted from animals to human beings. The bat may be the primary reservoir, but there are investigations ongoing with the linkage of wet market, or they call it a seafood market in Wuhan, China, the picture that I showed. But the most important and relevant factor is that person-to-person transmission is a reality. It has been proven, and that's the main mechanism how the people are getting infected. With close contact. The close contact means anywhere a distance less than 6 feet can get you infected. Can you move forward? So understanding the transmission, the virus actually lives in the saliva and the mucus, and anybody who is infected with the virus coughs or sneezes can generate the droplets. Those droplets carry the virus, and if they land on somebody's face, they can get infected, or if they land on the surface and someone else touches the surface and then touch their face or eyes without washing their hands, they may also get themselves infected. The virus is not showing airborne property like some of the other viruses which can spread through the air. The virus, hopefully, inshallah ta'ala, it's not airborne, it's mostly droplet, which is comparatively less contagious than the airborne viruses. So what are the symptoms? Can you move forward? So from the time of onset of the acquisition of the virus to the onset of the symptoms, it may take up to 1 to 12 days, but most of the patients, after they get infected, become symptomatic within 2 days. The common symptoms are fever of more than 100.4 degrees Fahrenheit. The other common symptoms are cough, muscle aches, and fatigue. Less commonly, patients can experience shortness of breath, mucus, blood in the sputum, or phlegm, headaches, sore throat, and runny nose. So what to do in case if you are experiencing some of those symptoms? Here's what the CDC wants everybody to know. If you have visited China or any endemic area where the coronavirus is spread, in the last 14 days and you are experiencing cough, fever, or shortness of breath, then CDC expects you to immediately report to the ER wearing a mask. So if you do not have the mask and you still have to go to the ER, then immediately tell the front desk at the ER that you came from China and you are experiencing the symptoms. So what the ER will do, can you move forward? So they will have to run tests. The test for the coronavirus is called polymerase chain reaction test. The test is not available through the commercial labs. So if you go to your regular doctors, they may not be helpful. They may be helpful in excluding some of the other respiratory illnesses, but they may not be helpful to exclude the coronavirus. They will have to contact the CDC. The hospital will have to contact the CDC, and the CDC will ship this kind of kit, as shown in the picture, to the public health laboratories, and they will run the test and confirm the virus. Move forward. So coming to the main topic, how to prevent the sickness. So what WHO and CDC is recommending from the general public is to emphasize more and more on the hand washing. Frequent hand washing as much as you can. If you do not have, preferably with soap and water, if you do not have access to the water, then you should try to keep alcohol hand rub in your pocket and use those alcohol hand rubs as much as possible, particularly after coughing or sneezing, or caring for a sick individual, or if you are preparing a food or before eating or after using the toilet. Can you move forward? So how to protect others from getting sick? So there are two things that CDC and WHO are recommending. Number one, practice respiratory hygiene, which means that emphasizing and encouraging everybody who has cough or is sneezing to cover their sneeze with a flexed elbow like this, or use a tissue paper and then discard the tissue paper immediately and then wash the hands. So that is the first aspect of practicing respiratory hygiene. The second aspect that they are expecting and emphasizing is to maintain social distancing. And what I mean by that is if you have sick with some kind of contagious virus, it's better to stay off of the public places. If you want to take time off, please take time off. And if you have to come in the public, you have to use the protective mechanism, meaning wearing a mask, or you'll have to avoid sneezing or coughing in close contact with someone else, and not to spit in the public. And if you are having symptoms, then please contact the doctor immediately. Move forward. So that's somebody who was trying to order facial mask and just found out that it was coming from China. So the question arises that are the masks even effective in preventing as a prevention tools? So what I would tell you that there is not much data showing that the masks, the regular masks, may prevent the transmission, but CDC expects anyone who has symptoms of cough and sneezing to put on a mask, or if you are taking care of somebody who is already sick, then you should also put on a mask before caring. So there are two types of masks available in the market. So one is called N95. That's an expensive one on the right, the white color. That's typically we are reserving its use in the hospital settings. In the community settings, right now you are not expected to go out in the public without having any symptoms. The universal wearing of the mask is not proposed right now. But if somebody is sick, then you can get your hands on this green color mask, which costs maybe 5 cents, and it may not be more effective, but not at least as effective as the N95 respiratory mask. Can you move forward? So the same guy asked, is it safe to receive a letter or a package from China? The question is yes. The research shows that the virus cannot thrive outside the human body for more than few hours. So in an ambient temperature, normal room temperature, if the package is shipped in a normal room temperature, the virus may not remain viable and may not be effective to cause any sort of infection. So it is safe. Can you move forward? So what is the treatment? Unfortunately, right now, there are no treatments for this virus. I have listed some of the names of the drugs which are in trial, but there are no conclusions yet. If you are having symptoms, let's say you need oxygen, those symptoms can be treated. If you go to the hospital will provide you symptomatic treatment. The question arises, there are other vaccines which protect from respiratory illnesses, for example, pneumococcal vaccines, for example, Haemophilus vaccine. The question is, do those vaccines provide you any protection or benefit from coronavirus? The short answer is probably no. But it's always a good idea to get yourself immunized because it may provide you an indirect protection from the severity of the coronavirus. If, God forbid, you ever have to have a coronavirus, you may have a milder disease if you were already immunized. The patients who have underlying lung conditions are more vulnerable to have very bad case of coronaviruses. So finally, can you move forward? So in this slide, I'm showing the comparison of the existing status of coronavirus compared to the flu virus. So far, what we know is global cases of coronavirus shown in the smaller circle, 40,000. All over the deaths worldwide, 1,000, and 12 cases in the United States. In comparison to the flu virus, which has caused 19 million cases, 180,000 hospitalizations, and 10,000 deaths just in the United States and just during the past 1 year, less than a year. So compared to flu, because the coronavirus is still like a baby. So the bigger threat to us right now is still a flu virus. Can you move forward? And I'll tell the audience that peak month of flu activity in the past 36 years of US data shows that February happens to be the peak season of the flu virus. So we had the first flu activity rising in the month of January. It's plateauing, and inshallah, we are hoping that as the temperature normalizes, we should see a downward trend of the flu activity, but you never know. Historically, February can still be a very high peak flu season. Next slide. So I've been asked the question, are flu vaccines still effective? I got this slide, I got this data from the CDC directly. It's the live data showing the activity of flu presence in the United States. And it's showing that it's very high level of activity all across the United States. Most of the states are still red, showing the very high activity of flu. So it's never too late. If you have access to the flu vaccine, it's better to get it. Some of the other vaccines which may benefit you from respiratory illnesses are pneumococcal vaccines. These are not routinely recommended. Haemophilus vaccines and measles vaccines, they may not be routinely recommended, but if you have some underlying condition, you can talk to me later on. You may qualify to receive some of these vaccines as well. Next slide. So takeaway messages. Number one, what the WHO and CDC is recommending. Number one, remember, practice hand hygiene as much as possible. Frequent hand washings. Number two, practice respiratory hygiene. Try to cover your sneeze and cough. Number three, if you're not vaccinated, get vaccinated. And finally, seek refuge from Allah, in Allah subhanahu wa ta'ala, and try to avoid going to China right now. Finally, so these were some of the frequently asked questions that I was asked, and I had to consult Imam Sahib to give me the answers for that, and he can elaborate further if he is still here listening. So I was asked, should I attend the masjid congregation if I have a communicable disease? So short answer, it's better to avoid. Secondly, can I wear a mask in the masjid and during salah? And the reply is, yes, in certain circumstances it's allowed to put on a mask. Thirdly, can I use alcohol-based hand sanitizers because they have alcohol? The short answer is, yes, you can use it, it's allowed. And finally, are vaccines allowed or favored in Islam? And the short answer is yes. If you need detailed answer, these are some of the Sharia-related questions. Maybe Imam Sahib can elaborate on those answers. But I'll be happy to take any questions if you guys have any questions. So I hope this talk was useful and will give you some, inshallah ta'ala, food for thought. Any questions? Yes, sir. We are not sure, but they are saying that up to 24 hours, the virus may survive and may still be viable until 24 hours to be safe. It may not, based off of the experience, the virus typically dies off within a couple of hours, but just to be a safer side, if you know that something will be contaminated, it's better to clean it. If not, then usually 24 hours. Any other? It may be more severe. The coronavirus, the symptoms may be more severe and the mortality may be higher. May not be as high as SARS virus back in 2002 that caused the outbreak. May not be as high as MERS virus, but it's definitely higher than the regular coronavirus family. Yeah. Yes, sir. Yes, yes. And somebody coughs? Yes. Yes. So yes, you will be, that's why they say that if you are at risk, you have a contagious illness, for the benefit of the community, it's better not to attend a public gathering. It's better to avoid. And if somebody is coughing, yes, then yes, we will be at risk. Yeah. That's a very good question. Inshallah, we are hoping not. The way we are containing the travel restrictions, putting on the travel restrictions, hopefully the virus will be contained geographically in one area, and inshallah we are not. That's why we are recommending that avoid traveling to the endemic area right now, just to contain the spread of the virus outside of China. But yeah, if people travel, then yes, it will be an issue.
How about
Yes, that.
That's the seafood products.
Ah.
Frozen seafood products are shipped from China to Chinatown or China.
I'll have to look it up then. Yeah, that may be risk. Because, but yes, exactly. There's frozen, anything which is frozen may increase the life of virus outside of the human body. Yes.
A lot of seafood products come
Yes.
from China, fish, a lot of stuff.
Yes.
That's
Yeah, if they have not followed the precautions and somebody was packaging who was sick, then yes, there may be a risk. Yeah. It's a blood test. Yeah, there's a blood test and there's a respiratory virus test. So they will swab your throat. Actually, I'm sorry, I take it back. It's a respiratory swab. They will swab your nasopharynx, just like a flu test. Yeah. Yeah. Okay, you have a. There, inshallah, there is a risk. There is let it put it this way. There is a risk of death, very small risk, yes. Jazakallah khair for coming in and listening and paying attention. Thank you very much. Okay. Jazakallah. Assalamu alaikum.
Does a frozen fish come from China?
Yeah, he has a very good question. Maybe it will be a risk.
It's very risky.
It's
because
risky.
Frozen and then you defrost it. Comes.
Defrosted, yeah. Well,
most
if
of
you
the-
are
most of
defrosting,
Yeah.
if you defrost, the virus technically will die off. If you cook food,
Then we die off.
it will definitely die off.
Yeah,
So the problem is people over there eat raw food. That's the biggest problem. So alhamdulillah, we always cook the food. So inshallah, if you are cooking, actually I had to point it out, I forgot. I didn't realize that somebody will ask me this question. Cooking food, inshallah, is a protective mechanism. Don't eat raw food.
Okay, no. But see, the reality because the people are sushi.
That's what I'm saying. So,
Very risky.
yeah.
And I think you need to tell the kids because they like sushi. And who knows, that fish comes from China.
Yeah,
And it's probably frozen and
Yeah.
defrosted, but then
yeah,
maybe that's so.
yeah. Assalamu alaikum.
It was very beneficial. I have one question. Two of my kids go to college and two attend school over here. And alhamdulillah, you also mentioned that there is no reported case in Texas, right? So far. And God forbid if there is ever these schools and they will always report and take precautions, right? Kind of?
They will have to. It's a public health issue, and the federal government is watching like a hawk.
Okay.
So,
So I'll tell my kids, especially the college-going kids, to wash hands and all those kind of things and but
so they have canceled, from what I am learning, that all the flights have been canceled and they are diverting everybody into 4 places to quarantine them. Meaning that you cannot just take a random flight from China and come to the United States any port. No, they're only designated 4 places where they bring the flights and then they quarantine those people for 14 days. That's how they're containing the virus.
because in college, there could be some student who could have just flown over there and came back, maybe just.
It's not possible anymore
And-
because the
okay.
government will quarantine anybody who is arriving from China.
Oh, okay.
But it's only China. So if somebody comes from elsewhere, because there are 24 countries where the virus has been found. So let's say he came from a different place and he was exposed, then yeah. That's why we eventually have to
Inshallah.
seek refuge in Allah
Yeah.
subhanahu wa ta'ala, but yeah.
But it was very beneficial. Thank you very much for the time.
Jazakallah. Assalamu alaikum.
Wait, can you live like a long, healthy life while having the coronavirus?
Long, healthy life, if you have, yes. If you recover, then yes, you will have a perfectly normal life.
Does the coronavirus affect your daily life?
If you are sick, then yes.